The objective of this presentation is to outline the metabolic pathways by which pitavastatin is processed and to illustrate that this processing leads to reduced potential for certain drug-to-drug interactions. The prevalence of high cholesterol in adult Americans is 33.5%, or approximately 71 million people. However, only 1 in 3 adults with high LDL cholesterol has the condition under control, with less than half getting appropriate treatment. In a study carried out with 10,138 American adults, 62% of former statin users cited a high incidence of side effects as the main reason they stopped taking statins. Pitavastatin calcium was first introduced in Japan in 2003, and FDA approval in the United States followed in 2009. FDA approval for Zypitamag, or pitavastatin magnesium, followed in 2017. The pitavastatin molecule has a unique structure which results in a high affinity for HMG-CoA reductase, effects on LDL-C and HDL-C, and a reduced potential for certain drug-to-drug interactions. Drug-to-drug interactions are a potential cause of adverse drug reactions. Adverse drug reactions represent up to 30% of hospital admissions in the United States and Canada. Approximately 32% of adverse drug reactions are preventable, with the cost per preventable adverse drug reactions estimated at approximately $9.6 billion annually. Although many drugs, and most statins, are metabolized by the cytochrome P450 pathway of enzymes, pitavastatin is largely metabolized through a process of chemical modification. This decreased dependence on the cytochrome P450 pathway reduces the potential for many drug-to-drug interactions. Studies have shown that there are no clinically significant differences in the total exposure to or the maximum concentration of pitavastatin when co-administered with the following:
Important safety information for Zypitamag pitavastatin tablets. Indications and usage. Zypitamag is indicated as an adjunctive therapy to diet in adult patients with primary hyperlipidemia or mixed dyslipidemia to reduce elevated total cholesterol, low-density lipoprotein cholesterol or LDL-C, apolipoprotein B, triglycerides, and to increase high-density lipoprotein cholesterol or HDL-C. The effect of Zypitamag on cardiovascular morbidity and mortality has not been determined. Contraindications. Zypitamag is contraindicated in patients with known hypersensitivity to product components, in patients with active liver disease, which may include unexplained persistent elevations in hepatic transaminase levels, in women who are pregnant or may become pregnant, in nursing mothers, or in co-administration with cyclosporin. Warnings and precautions. Myopathy and rhabdomyolysis. Risk factors include age 65 and greater, renal impairment, inadequately treated hypothyroidism, concomitant use of certain drugs, and higher doses of Zypitamag. Zypitamag is contraindicated in patients taking cyclosporin and not recommended in patients taking gemfibrozil. The following drugs, when used concomitantly with Zypitamag, may also increase the risk of myopathy and rhabdomyolysis. Lipid-modifying dosages of niacin of greater than 1 gram per day, fibrates, and colchicine. Discontinue Zypitamag if markedly elevated CK levels occur or myopathy is diagnosed or suspected. Temporarily discontinue Zypitamag in patients experiencing an acute or serious condition at high risk of developing renal failure secondary to rhabdomyolysis, such as sepsis, shock, severe hypovolemia, major surgery, trauma, severe metabolic, endocrine, or electrolyte disorders, or uncontrolled epilepsy. Inform patients of the risk of myopathy and rhabdomyolysis when starting or increasing Zypitamag dosage. Instruct patients to promptly report any unexplained muscle pain, tenderness, or weakness, particularly if accompanied by malaise or fever. Immune-mediated necrotizing myopathy, or IMNM. There have been rare reports of IMNM, an autoimmune myopathy associated with statin use. IMNM is characterized by proximal muscle weakness and elevated serum creatine kinase, which persist despite discontinuation of statin treatment, positive anti-HMG-CoA reductase antibody, muscle biopsy showing necrotizing myopathy, and improvement with immunosuppressive agents. Hepatic dysfunction. Increases in serum transaminases can occur. Rare post-marketing reports of fatal and non-fatal hepatic failure have occurred. Consider liver enzyme testing before initiating therapy, and as clinically indicated thereafter. If serious hepatic injury with clinical symptoms and/or hyperbilirubinemia or jaundice occurs, promptly discontinue Zypitamag. Increases in hemoglobin A1C and fasting serum glucose levels. Increases of each have been reported with statins, including Zypitamag. Optimize lifestyle measures, including regular exercise, maintaining a healthy body weight, and making healthy food choices. Adverse reactions. The most frequent adverse reactions with a rate of greater than 2% are myalgia, back pain, diarrhea, constipation, and pain in the extremities. This is not a complete list of all reported adverse events. For additional information, please refer to full prescribing information. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.